Moments of the season and welcome to Sound Health. I am Olasunbo Modupe. On Sound Health today, we are looking at emergency use authorization for COVID-19 vaccines. But first, we begin with COVID-19 update. Please stay with us.
COVAX now has arrangements in place to access nearly 2 billion doses of COVID-19 vaccine candidates on behalf of 190 participating economies. The arrangements will enable all participating economies to have access to doses in the first half of 2021, with first deliveries anticipated to begin in the first quarter of 2021. With first deliveries anticipated to begin in the first quarter of 2021, contingent upon regulatory approvals and countries' readiness for delivery. The initiative announced that for the vast majority of these deals, COVAX has guaranteed access to a portion of the first wave of production, followed by volume scales as further supply becomes available. Despite these are arrangements for 2 billion doses of vaccine candidates, which are still under development. This announcement offers the clearest pathway yet to end the acute phase of the pandemic by protecting the most vulnerable populations around the world. This includes delivering at least 1.3 billion donor-funded doses of approved vaccines in 2021 to the 92 low and middle-income economies eligible for the COVAX AMC. The new deals also announced include the signing of an advance purchase agreement with AstraZeneca for 170 million doses of the AstraZeneca Oxford candidate and a memorandum of understanding with Johnson & Johnson for 500 million doses of the Janssen candidate, which is currently being investigated as a single-dose vaccine. These deals are in addition to existing agreements COVAX has with the Serum Institute of India for 200 million doses with options for up to 900 million doses more of either the AstraZeneca, Oxford or Novavax candidate, as well as a statement of intent for 200 million doses of the Sanofi GSK vaccine candidate. The Lagos State government has urged residents to avail themselves of the free COVID-19 testing services offered at approved public laboratories across the state. It advised anyone with symptoms that fit the case definition of COVID-19 to visit any of the centers for testing free of charge. The state government also urged residents to call the Eco Telemed toll-free line on 0800 03 56633 to speak with any of its medical personnel for inquiries. In Nigeria, more than 78,000 cases and above 1,200 deaths have been recorded. Globally, there have been over 74 million confirmed cases of COVID-19, including more than 1.6 million deaths reported to WHO.
It is still Sound Health on Lagos Television. I am being joined now by Dr. Odunayo Talabi, a vaccine advocate, public health physician, and the managing director, Pretty Healthcare. Dr. Talabi is talking to us from Lagos via Skype. Dr. Talabi, welcome to the show.
Thank you for having me.
Okay, can you please help us understand what an emergency use authorization is during this time?
Yes, thank you. So, vaccines are very important public health initiatives and they save countless number of lives. They are also one of the most cost-effective health intervention. Therefore, they have always been important and they will remain important. And we can see how even in this time of COVID-19, vaccines again are coming to the rescue. So, why do we say emergency authorization or emergency use? It's because vaccines ordinarily undergo rigorous works before they are approved for use in humans. So you test them in animals, then you test them in a group of people, in hundreds, then thousands. Then you also test them in heterogeneous group of people, meaning that people who are not genetically related, you test them. So this process takes years. But when you now want to produce a vaccine from the stage of development to use in millions of people in less than a year, that becomes an emergency use.
Okay, we have a couple of vaccines out there waiting approval. So, some of them are still at trials. Why are emergency use authorization necessary?
Yes, so if you see the trajectory of COVID-19, you notice that this is a pandemic. We are talking of millions of lives. We are talking of millions of people infected and millions, at least almost 2 million who have died from the infection. So you now begin to think that how do we stop this infection in its tracks? Why vaccines take so long to develop is that we want to ensure that even if there is a minor risk in any population, you don't want to use that vaccine. But when you see that the risk is much lower than, the benefit far outweighs the risk, then you have no choice than to use it. People are dying every day due to COVID-19 and we want to stop that. If vaccines can do that for us, then we want to at least ensure that we stop to that. Hence, the emergency use. The benefits outweighs the risk.
So they are safe for use?
Absolutely. Now, safe for use in the sense that every protocol that should have been followed to develop vaccines have been followed in developing the candidates that we have now. There's a difference. I guess the only difference is that ordinarily, when you have checked all your data for vaccines and you have confirmed that, okay, this thing is safe for use, there is still another study where you now monitor the first few people who took the vaccine over some years to rule out long-term adverse effects. In this case, that will be lost because we are using them now and we are giving it to many people. Ordinarily, they should have been after those years that you now go public. But now we are going public because, like I said before, the benefit outweighs the risk. And we want to ensure that we stop the infection and the death that are resulting from daily COVID-19 infection.
Okay, that brings me to my next question now. What is the protocol for administration for these two brands now? We know Pfizer and Moderna. Some experts recommend 2 jabs, just 2 jabs.
Yeah, so we are relying on information from the trials we have had on these vaccines. So, and how they go about it is they show that, okay, we gave a group of people this vaccine, and by the time we measure the antibody level, we see that it is at this point that you give a booster dose. All these are kind of preliminary in the sense that we are still going to learn a lot about those vaccines. Remember, we are also still learning about the disease itself. So, but from what we have now, the recommended dosage is basically two doses at least a month apart.
Okay, Dr. Talabi, let's take a look at some issues raised during research. The research is still ongoing now. Do I still need a vaccine if I have had COVID-19?
Yes, so that is a question that is also a bit difficult to answer. However, I'll look at it this way. It has always been known that natural infection will give more immunity than infection from vaccine. However, people who have had COVID-19 before, first we are studying how long will antibody last in their bodies. Second is that how protective is that antibody? Because if it wanes quickly, then you cannot rely on natural immunity to protect them. So the current tentative recommendation is that those people should take as long as they are in the high risk groups who are qualified for these vaccines.
Okay, is it okay to have a different second dose?
Yeah, so I want to believe that what you mean by that is you take
The
one
first
brand
jab.
as first dose,
Okay.
and then you take another brand as second dose.
Yes.
Now, the vaccine candidates we have now are a bit different. So they are different in the sense that one was developed for messenger RNA, another was developed the usual way to develop vaccine. You look for either a killed version of vaccine or a weakened version, and you inject it into the body. So because of that, it may not be recommendable that you should take different. Remember I said we are still studying the effect of individual vaccines. So if someone takes vaccine A as the first dose, vaccine B as the second dose, and there's a reaction, then which vaccine caused the reaction in the person? That would be difficult. So I don't foresee having to use different doses to complete a dosing. Also is the fact that the vaccine itself may not be available in large quantities at the beginning. So if you have one from a particular brand, you are not likely to have the luxury of buying from another brand because we are trying to ration it to make sure it goes round. So most likely, one is going to have access to just one brand. Most likely.
Experts also worry about vaccinating people who previously got COVID-19, particularly if these people have lingering symptoms. Under this circumstance, there is always vaccine priority. What's your take on this?
Yes, so I'll just say that, as has been known for years, if someone is actively still having symptoms of infection, especially of an infection for which you want to give a vaccine, you don't vaccinate. You don't vaccinate such individuals. You wait until the effects of that infection has cleared. Otherwise, you will not be able to tell if it is the infection or the vaccination that caused that. And you don't want to worsen an ongoing infection. This is the reason why they tell mothers that if your child is having fever, they will not vaccinate. Because they know that some of the side effects of the vaccine itself is fever, and you won't be able to tell those symptoms apart.
At a time like this, there's always vaccines priority group. Who should get the vaccine first now?
So, they are trying to form a protocol regarding this to say that who needs the vaccine first? Actually, the simple answer is those in the high-risk groups. They need the vaccine first. So, we are talking of medical workers, people that are going to come in contact with many people with COVID-19. You want to ensure that they are kept safe, so because they are at higher risk, and then so that they can be there because they are frontline. You want them to be able to fight the infection. So those ones are going to be considered. Then we are going to look at people with underlying diseases, people who are elderly, because those are the groups that are more at risk based on the evidence we have so far about COVID-19. So they will prioritize it that way, and you can tell for free that elderly people are likely going to get the vaccine before younger people, because the effect in elderly is more than in younger generation.
Although there is insufficient data to conclude whether Pfizer's coronavirus vaccine is safe for kids under 16, pregnant women, and immunocompromised people, do you share a different view?
Yes, so one is usually very careful when it comes to groups like this, immunocompromised pregnant people, because you know that whatever affects the mother will most likely also affect the baby. So you want to be careful. So these groups are not likely to be prioritized because you want to be careful of adverse reactions. However, going back to where I started from, if the benefits in a pregnant woman far outweighs the risk, then that pregnant woman can get it. Because you know that if the pregnant woman also has COVID-19, it's a risk to her and to the baby also. So my answer to that would be that they will not be prioritized. But whenever the benefits outweighs the risk, of course they will get it. And that will now be on an individual basis and based on recommendation of the physicians.
As an expert in this field, how do you handle side effects like fatigue, headache?
Okay, you are talking of side effects now.
Yes.
So basically, practically all vaccines have some minor side effects. Pain at the site of injection, headache, fever. Those are not long lasting. They are usually temporary, and then they are easily managed. So one may not worry about that. If that is the only reaction or side effect that's associated with COVID-19 vaccine, I don't think we need to worry so much about it.
Okay, looking at the COVAX initiative, is there hope of getting the vaccine soon in the country?
Yes, so the COVAX initiative is to ensure equitable distribution of vaccines. So what they are saying is that whoever needs COVID-19 vaccine should get it, irrespective of whether the person can afford it or not, irrespective of which country the person lives. Whoever needs it, according to what the global health community is planning, should get that vaccine. That is the simple definition of that initiative. Be that as it may, we still need to prioritize. For instance, you see that the total COVID-19 infection in Nigeria is less than 100,000 as of now. Meanwhile, in the US, it's over 16 million. So you want to, if you have 50 million doses of vaccine, then you will know that most of it will go to the US because there are people dying daily from COVID-19. The pandemic is hitting them more. So, of course, there is hope that country like Nigeria will get under that initiative. It may not be the first country to get, because you have to judiciously utilize the doses you have. Under the initiative, we are assured of getting. We may not be the first country in line to get it. So, my advice is we continue our social distancing and other non-therapeutic measures to keep safe from COVID-19 and to avoid second wave, to avoid explosion, and to avoid having to be in the position of countries who have large number of cases.
Thank you for your time and resources, Dr. Talabi.
Absolutely. Thank you.
I have been speaking with Dr. Odunayo Talabi on emergency use authorization for COVID-19 vaccines via Skype. Dr. Talabi is a vaccine advocate, public health physician, and the MD Pretty Health Care. Sound Health continues with trending health reports. It's still Sound Health on Lagos Television. No doubt, the only hope against COVID-19 is the vaccine. However, pending the arrival, strict adherence to precautionary measures such as hand washing, use of masks, and social distancing will reduce the risk. Stay safe at all times. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, please send SMS to 0035 826603 or follow us on social media at LTV Social, hashtag Sound Health. A sound health is a sound mind. Make healthy living your choice.